The topic of our lecture today is antiviral drugs for the treatment of herpes simplex virus and varicella zoster virus infections. We're going to talk about three distinct patterns of viral infection. Each of these are characterized by a different interaction between the virus and the host immune system. So viral infection can be either acute infection, which is the most common pattern of viral infection, where the virus enters the body, causes the illness, and then completely cleared by the immune system. The immune response is able to recognize and eliminate the virus, leading to complete resolution of the symptoms. So again, in the cases of acute infection, we have the virus entering our body. After it causes the illness or the disease, it's going to be cleared out completely by our immune system. Examples of these kind of viral infection include influenza virus or rubella virus, where the individual typically recovers fully without any long-term viral persistence, so the virus doesn't stay in our body. The second pattern of viral infection is the latent infection. At the latent infection, the virus will initially go into an acute infection, but later on it will stay in the body, so it persists in the body in a non-infectious dormant form. So again, very important to know that we have initially an acute infection, but then later on the virus doesn't leave the body, it stays in the body, but it stays in a non-infectious form that's dormant, يعني خامل. The virus doesn't actively replicate, but it can reactivate at any time. Sometimes due to different factors, for example, stress or a weak immune system. Now, once we have this condition and the virus is reactivated, it can then shed from the body again, and it can start causing the symptoms again. Examples of these latent infections, we have chickenpox, and if you remember, chickenpox can later reactivate in the form of shingles. We have herpes simplex virus, where the virus remains in the body and can flare up intermittently, and it can cause either herpes labialis or genital herpes. The third pattern is the chronic infection, or what we call the progressive or persistent infection. In the chronic infection, the virus is not cleared by the immune system, and instead it stays in the body for a long period of time. It can replicate continuously, or it stays in the tissues, leading to long-term viral shedding and persistence in the host. So it stays in the body and it can replicate, it can shed, and it can result in ongoing symptoms, or in some cases it can result in progressive damage to organs or tissues. Example of viruses of this kind, we have the HIV virus, the hepatitis C virus, and in this case the virus again persists in the body and can cause long-term health complications. In general, these three patterns demonstrate the varying ways in which viruses interact with their host, from complete clearance to persistence and finally ongoing infection. Let's start talking about the different antiviral drugs for the treatment of herpes simplex virus and varicella zoster virus infections. Talking about oral nucleosides analogs, these drugs are licensed for the treatment of viral infections, specifically those by the herpes simplex virus and the herpes zoster or shingles virus. These include acyclovir, valacyclovir, and famciclovir. All of these three medications are well tolerated by the patient, meaning that they have good safety profile with minimal adverse effects on most of the cases. Now, talking about acyclovir, it was the first drug of these three to be licensed. It's also the only one available for intravenous use in the United States. It's typically used for more severe or complicated infections, such as infections in immunocompromised patients or in cases of disseminated herpes infection. So, again, when we using the cyclovir's IV infusion, we use it mainly for severe or complicated infection. These include infections in patients who have immunocompromised conditions, or if we have a generalized or disseminated herpes infection. With regard to valacyclovir and famciclovir, both of them have similar efficacy to acyclovir in the treatment of herpes simplex virus infection, but they show superiority, so they are better in the treatment of herpes zoster infection. The convenience of these agents is that we have less frequent dosing compared to acyclovir, and this can improve the compliance or the adherence of the patient to the treatment regime. So if we want to summarize their comparison efficacy, while these three medications can be effective in treating HSV infection or herpes simplex infections, famciclovir and valacyclovir have modest superiority in herpes zoster. Again, we're talking about the reactivation of the Varicella zoster causing shingles. Again, to rearrange our thoughts, we can still use acyclovir, but famciclovir and valacyclovir may be preferred in herpes zoster infection due to better overall outcome and a more convenient dosing schedule. To the mechanism of how these agents work. Again, we said these agents are nucleoside analogs, and this include again acyclovir, valacyclovir, including also another antiviral drug we're going to mention later called foscarnet. They can interfere with the viral replication by incorporating false DNA building blocks or nucleosides. So that means these are chemical. They resemble the normal building block of the DNA, but with a slight structural modification. Because of this alteration, these nucleosides are not proper DNA components, and they can result in disruption of the viral DNA synthesis. Usually, the nucleosides consist of a nucleobase, a sugar. In the cases of DNA, we have the deoxyribose. When the drug is used, it mimics this structure, but it has a flaw in its structure that prevents it from functioning normally in the DNA chain. With regards to their activation, we see that valacyclovir is a prodrug. It needs to be activated in the body for better bioavailability. Now, how are these drugs activated? For example, here we have acyclovir. Acyclovir requires 3 phosphorylation steps for its activation. So we have the addition of 3-phosphate group to the nucleoside by cellular enzyme, transforming the drug into its active form. These phosphorylation steps are crucial because they allow the drug to be incorporated into the viral DNA. Now, because the drug acyclovir requires the viral kinase for initiation of phosphorylation, we can then say acyclovir is selectively activated. So it's only activated if we have a viral infection, because the first step of its activation requires the viral kinase. And if we look here, acyclovir, which is a guanine analog, it can be activated again with 3 phosphorylation steps. The first phosphorylation step happens by a viral kinase called thymidine kinase. The next 2 phosphorylation steps occur by the activation of cellular kinases. After its activation, it can selectively inhibit viral DNA polymerase. This is number 1 mechanism. The second mechanism, it can get incorporated in the DNA and it can terminate the DNA synthesis. Now, resistance to these antiviral medication has developed, and it occurs because we have decrease in the activity of the viral thymidine kinase, which can, of course, hinder its activation. It's necessary to have this viral thymidine kinase active for the activation of this drug. Another mechanism of resistance is the altered DNA polymerase activity. This picture also shows us a detailed explanation. So we have a cyclovir here that needs to be activated by the first step, again, a viral thymidine kinase. And the next two steps, we have phosphorylation by cellular kinases. Once it's activated, it can either cause inhibition of the DNA replication by inhibiting the viral DNA polymerase, or it can get incorporated in the elongating DNA chain leading to DNA chain termination. This figure here shows us a summary of how some antiviral drugs work. Again, we said acyclovir, in addition to other nucleosides analogs such as penciclovir, ganicyclovir, they need to be activated by a virus-specific thymidine kinase, and then they're going to be activated by host kinases into a diphosphate and then a triphosphate. We said these can get incorporated into the viral DNA, causing chain replication, or they can cause inhibition of viral DNA polymerase. We have another drug here. We have foscarnet. Unlike acyclovir and valacyclovir, which are nucleoside analogs, foscarnet is a non-nucleoside antiviral. It directly inhibits the viral DNA polymerase, as we can see here. So it causes competitive inhibition of viral DNA polymerase, which is, of course, the enzyme responsible for DNA synthesis of the virus. It does so by interfering with the enzyme function, preventing the addition of nucleosides or new nucleosides to the growing DNA chain. We want to talk about the pharmacokinetics of acyclovir. The bioavailability of acyclovir is pretty low. It's about 15 to 20%. So when taken by mouth, only a small fraction of the drug gets to the bloodstream and it's utilized by the body. The food does not interact or affect the absorption of acyclovir. We mentioned that we have an intravenous formulation available. Of course, the indication for intravenous formulation are if we have an immunocompromised patient, if we have disseminated infection, or if we have a patient who cannot tolerate or he cannot take an oral form. Now, advantages of a IV formulation, of course, is that we have higher concentration of the drug delivered directly into the bloodstream, ensuring more effective treatment. Other formulations, we have topical formulations in the form of cream and ointments. Usually these are applied directly to the affected areas such as the herpetic lesions. The topical formulation achieve high local concentration at the site of injection, even though systemic concentration are undetectable through this route. With regards to the clearance, acyclovir mainly is cleared by the glomerular filtration and also by tubular secretion. The half-life of acyclovir is 2 to 3 hours, 2.5 to 3 hours if we have a normal renal function. We see that this is a short half-life, meaning that the drug is eliminated from the body quickly, which can result in multiple dosings of the drug administered for the patient, whether we are talking about oral or IV formulation. To compare the effectiveness of oral acyclovir in different types of herpes virus infection. Here we're comparing recurrent herpes labialis. These are the cold sores that are caused by herpes simplex virus, and comparing it with the varicella infection. Again, this is chickenpox caused by varicella zoster virus. What we see is that oral acyclovir have a modest benefit in treating recurrent herpes labialis, which we call cold sores. It can reduce the severity and frequency of the outbreak, but it doesn't provide significant relief in all the cases. This is maybe because the virus can have a predictable course, and while acyclovir can shorten the duration and reduce the number of outbreaks, its effects are limited compared to other treatment options for herpes simplex virus. On the other hand, when we're talking about acyclovir therapy for varicella, it is much more effective in treating varicella zoster virus. It can significantly reduce the total number of lesions, the duration of the symptoms, and the viral shedding in patients with varicella. However, because varicella zoster virus is less susceptible to acyclovir than herpes simplex virus, we need higher doses for that. To summarize, for herpes labialis cold sores, oral acyclovir is moderately helpful but not a definitive treatment. For varicella or chickenpox, acyclovir significantly improves the outcome. It reduces the lesion, the symptoms, the viral shedding, but we can need higher doses due to the lower susceptibility of varicella zoster virus to the drug. Now, because we have these variation in effectiveness, we need to tailor antiviral therapy based on the type of infection and the virus involved, and of course the patient condition. Here is a table that summarizes the agents that are used to treat or prevent herpes simplex virus and varicella zoster virus infection with the doses recommended. We can see the first drug here is acyclovir, and it can be administered orally. We said intravenously or topically. These are a summary of its indications, and as we mentioned earlier, we were not going to worry about memorizing doses for this, but this can help us see the differences between the doses for the different drugs. What we want to focus on is the different recommendations or uses. So for example, oral form of acyclovir is used to treat first episode of genital herpes. It can be also used to treat recurrent genital herpes. It can be used to treat genital herpes in HIV-infected patients, and it can lead to genital herpes suppression in HIV-infected patients. It's also helpful in treating herpes prochytis, orolabial herpes treatment, varicella treatment in patients who are above the age of 2, and zoster treatment. The intravenous indication is where we have severe herpes simplex virus infection, or it's used to treat severe herpes simplex virus, mucocutaneous herpes in immunocompromised patients, herpes encephalitis, neonatal HSV infection, and varicella or zoster in immunocompromised patient. The topical treatment, which is a 5% cream, is mainly used to treat herpes labialis. And as we said, the half-life of this drug is short, so we can note here it has to be administered multiple times a day. For example, the cream 5 times a day. The oral, if we look here, we have TID 3 times a day. Here, 3 to 5 times a day. Then we have, for some condition, 5 times a day. And this can be a drawback for some drug, because if we have multiple dosing, this will lower the adherence of the patient to take the proper doses of the drug. With regard to side effects of acyclovir, they depend on the route of administration. For example, when used topically, we can see local irritation, When used orally, we can see headache, diarrhea, nausea, and vomiting. Also, transient renal dysfunction may occur at high doses or when the drug is given intravenously for the patient, especially if the patient is dehydrated. About resistance previously, we said resistance can occur due to altered or deficient thymidine kinase or problems or mutations in the DNA polymerase. So we have two different kinds of mechanisms of resistance, either alteration or deficiency in the thymidine kinase enzyme needed for the first phosphorylation step for the activation of these nucleosides analog, or mutation of the DNA polymerase, the enzyme that the drug inhibits, which can hinder or it can lead to less binding between the drug and the DNA polymerase. So this means less effectivity in its inhibitory potential for the DNA polymerase activity. And these strains have been commonly been isolated from immunocompromised patient. Now talking about valacyclovir. Valacyclovir is the valyl ester of acyclovir, so it's very similar to acyclovir. It gets converted to acyclovir after oral administration through the first pass enzymatic hydrolysis in the liver and the intestine, resulting in serum levels that are 3 to 5 times greater than those achieved with oral acyclovir. Clinical uses of valacyclovir is again for the treatment of either first-time or recurrent herpes infection, suppression of frequent recurring genital herpes. It can be also used for the treatment of orolabial herpes and the treatment of varicella and also herpes zoster infection. Usually it's administered once a day, and this, we said, method of administration or way of administration help the patient adhere to the treatment more because we don't have to take the drug as many times. If we take the drug too many times a day, the patient will lose one of these doses. He will forget one of these doses. If we have a drug that's administered once a day, this increases the compliance and the adherence of the patient to the regime. Now, this once daily dosing of valacyclovir is used for chronic suppression in persons with recurrent genital herpes, and it has been shown to markedly decrease the risk of the sexual transmission of the condition. Moving on to foscarnet, we mentioned that foscarnet is different than other nucleosides analog. It's not a purine or pyrimidine analog. Instead, it's a phosphormate derivative or a pyrophosphate derivative. It does not require activation by neither viral nor cellular kinases. It's mainly used to treat CMV cytomegalovirus infection, including retinitis or other kind of cytomegalovirus infection. It can also be beneficial in the treatment of herpes simplex and HIV infection. Its main recommendation or use, it's approved for cytomegalovirus retinitis in immunocompromised hosts and also for acyclovir-resistant herpes simplex virus infection. So this is very important. I put it in red here for you. The uses of foscarnet. It's cytomegalovirus retinitis in immunocompromised patients, for example, patients who have HIV. Also, another indication is patients who have developed resistant for acyclovir. We call them acyclovir-resistant herpes simplex virus infection. To summarize the mechanism of action of foscarnet, it works by reversibly inhibiting the viral DNA and RNA polymerase. So it's a competitive inhibitor of these DNA polymerases. It interferes with the DNA and RNA synthesis. And if we have a mutation in these polymerases, this can result in the development of resistant virus. It's poorly absorbed orally, so it is mainly used as an injection intravenously. It must be given multiple injections or over different times of infusion, because we don't want to have a relapse in the patient if the plasma levels become below the minimum effective concentration. So again, we give it frequently to the patient to avoid relapse when the plasma levels fall. It is dispersed throughout the body, and greater than 10% of the drug enters the bone matrix, from where it slowly leaves. The parent drug gets eliminated by glomerular filtration and tubular excretion. This is regarding the clearance of this drug. Now, with regards to adverse effect, we have a most common side effect which can cause nephrotoxicity. So about 25% of the patient can suffer from nephrotoxicity associated with foscarnet treatment. A less common side effect, some patients experience anemia, nausea, and fever. Because this drug results in chelation with divalent cations, we can see hypocalcemia, we can see hypomagnesemia. In addition, hypokalemia, hypo and hyperphosphatemia, seizures, and arrhythmias have been reported. Now moving on to talk about another group of drugs, or another drug called vidarabine. Vidarabine works by selectively inhibition the virally encoded DNA polymerase more than, of course, the indigenous, the human DNA polymerase. It is a chain terminator. It's active against herpes simplex, varicella zoster, and vaccinia. It's limited to topical treatment in the cases of severe herpes simplex infection. Before the start of the use of IV acyclovir, this drug was used in the treatment of herpes simplex encephalitis. Also, it is used in the treatment of immunocompromised patients who have herpetic or vaccinia, keratitis, and keratoconjunctivitis. To talk a little bit about ganiciclovir, we mentioned it in the previous slides. It has the same mechanism as acyclovir, so it requires the activation of triphosphorylation before it can either inhibit the viral DNA polymerase or it can cause termination of the viral DNA elongation. It is active against all herpes viruses, including cytomegalovirus, and it's 100 times more effective than acyclovir in the treatment of cytomegalovirus. It has a low oral bioavailability, so usually it's given IV. It can also be used as a gel formulation for herpetic keratitis. With regards to side effects associated with ganciclovir, we can see some serious adverse effects. The most common adverse effects seen, we have bone marrow suppression, so we have leukopenia in 40% of individuals, thrombocytopenia in 20%. That's why this drug have actually a black box warning. Because of these serious side effects. Also, it is a potential human carcinogen. It is a teratogen, so it is absolutely contraindicated in pregnancy, and it's a mutagen. It can lead to mutation, which can increase the risk for the development of cancer later on. Other side effects include central nervous system effects, including headache, but also behavioral psychosis, coma, and convulsions. Because of these side effects, 1/3 of the patients have to stop treatment. Now, for its indication, it is the drug of choice. This is very important. When you read the sentence, the drug of choice, it's very important to know for the treatment of cytomegalovirus infections, including retinitis, pneumonia, and colitis. Finally, here, this table shows us a summary. This is the other half of the table we put before. So this summarizes the indication or the uses of these different antiviral medications that we talked about. So we have famciclovir. To summarize, it can be used to treat genital herpes, whether in the first episode or in the recurrence. It's also used to treat HIV patients with genital herpes, to suppress also genital herpes in these patients. It's used to treat orolabial herpes and orolabial and genital herpes suppression and zoster. Valacyclovir have the same indications as well, but usually for varicella it's reserved for patients above the age of 12. With regards to foscarnet, it can be used mainly intravenously for the acyclovir resistant either herpes simplex virus infection or varicella zoster infection. This is very important. These three drugs we didn't talk about, they're mainly used topically for the treatment of herpes labialis or herpes genitalis. For trifluridine, it's mainly reserved for treatment of acyclovir resistant herpes simplex virus infection. And again, this is a topically administered drug. So that's it for antiviral medication for the treatment of herpes infections. Please focus on special side effects, focus on their mechanism of actions, and with regards to the viruses, how they develop resistance for these drugs. Thank you so much.